Hi, I'm Dr. Raj Banerjee, and welcome to the Stem Cell Enhancement Program. All right, so this is a really important video because we're in week 6 right now. And if you have gotten your stem cells 6 weeks ago, 5 weeks ago, they're still replicating. And at this point, you can start doing more aggressive kind of exercises, weightlifting, really kind of doing more things. You don't have to baby your knees and shoulders if you had those areas injected. Also, on top of that, most people around week 6, they're getting really good results. The pain level is down. They're noticing that they can do a lot more things, and their energy is coming back up. So I want to share with you another supplement that if you are not one of those patients that are seeing these kind of results, how you can actually enhance the stem cells to do what it needs to do. And this is a supplement, this is a Chinese medicine patches and certain herbs that will actually help enhance everything that you're doing. You don't want to do these right in the beginning because you want to let the stem cells kind of do its work. And usually patients that are around 6 weeks to 12 weeks in, if the pain level is down but they're not completely all the way down, this is what they implement. And this is where really it gives them the benefit where they don't have to do more stem cell injections. Now, you could always do more stem cell injections, but this will get you to where the cells that's already there dividing and replicating can actually do even better job for you. Okay, so the place you want to go to get these supplements and patches is called regenherbs.com, regenherbs.com. And what you're going to see in there is you're going to see these Whitee patches. You're going to see this supplement called LC Balancer, and you're also going to see a supplement called Brown Supplement, okay? And so these are what's going to help you rebuild cartilage and kind of help the stem cells if you had the stem cells done to help with stenosis or disc issues or bone spurs, and you see the pain level has gotten down but the bone spurs are still there. This is what you're going to need to totally dissolve those bone spurs and clear out the stenosis, okay? So what these patches and these two supplements will do, there's 3 main mechanisms at the basic level. What the patches are doing is bringing blood flow to the area of where the patch is. So by increasing that local blood circulation, you're going to be ensuring that the damaged tissue are going to receive a lot of oxygen nutrients from the blood, basically. And it's going to help regenerate those tissues and get the stem cells. Again, you want the stem cells to get in there. So that's number 1. So it's going to increase microcirculation. Then the next step would be the patches is going to increase the metabolic reactions for effective damage repair. So it stimulates the body's own processes of creating and generating more collagen, microfibers, proteoglycans, osteoblasts, and the structural components of the tissue that's damaged. So the patches is activating these metabolic reactions, and then the next step, you're going to be increasing the metabolic processes. There's going to be more metabolic waste, right? So you want to help remove that waste. So the patches will help the lymphatic circulation locally in the area where the patch to help draw out the metabolic waste. It's also going to help draw out the inflammation in the area as well. This is why you don't want to use these patches right in the beginning. You want to wait at least 6 to 12 weeks before you put these patches on. So by increasing that, it's actually creating a better environment in your body. The thing is, the more the chronic inflammation stays in that one area, there's more damage to that cell. And so what it's doing is removing those molecules and creating the best environment for the cells to receive those nutrients that the patch is also bringing in. Another component for joints specifically, like knees and hips and shoulders, wrist, elbows, any kind of osteoarthritis, there's a cartilage degradation. Like in the knee, for example, there's damage done, there's a release of inflammatory cytokines, and what it does is that it produces a matrix degrading enzyme, and then that further degrades the cartilage because of all the molecules are stuck in the synovial fluid, which is surrounded by the synovial membrane. And you can see that in the picture here. And then what happens? The research shows that it disrupts the permeability of the synovial membrane so that it further prevents the nutrients from coming in and causes a buildup of those inflammatory molecules inside the joint as well. So it's almost like a vicious cycle. You can't get the nutrients in, you can't get the waste products out, and it causes more deterioration. One of the use of the patches is the supplement I just showed you, the LC Balancer. And when you put them together, what's going to do is it's going to increase the blood flow to the synovial membrane. It's going to help restore the permeability of the membrane as well. And with the patch drawing out the lymphatic circulation, it's going to help bring out the waste products and the inflammatory molecules back into balance again. And what it really does, it creates a nice environment so the healing can happen and the stem cells can again do what it needs to do. So in essence, the patch again helps restore the permeability of the synovial membrane. So additional things about the Whitee patch. A few things that you need to know about that will help with stenosis and bone spurs. The first is that it's going to help dissolve calcification involved in these conditions like stenosis, osteoarthritis, bone spurs, all of that. The other thing that the extra herbs and the Whitee patch are doing is helping to calm the nerve response. So sometimes in the healing process there's pain spikes, and the Whitee patches with those additional ingredients are designed to prevent that pain spike from happening. And that just helps with the pain response as well. And then in terms of the LC balancer, where this fits in, is designed to increase the microcirculation systemically. So if it's stenosis that you have, or if it's bulging disc, then typically what we've found is that there's calcification within the cartilaginous end plates. You can see in the picture here. It prevents nutrients to get back into the disc and basically the spinal canal. And if there's calcification there, there's less avenues for the blood to bring in more nutrients and oxygen in those tissues. So the LC balancer, again, it's improving the microcirculation. We're going to enhance the delivery of the nutrients. If it's the knee, it's helping make delivering of more of those channels and blood flow into the synovial membrane, and it's helping with the delivery of just basically rebalancing the permeability in your joints. So that's what it does. It works really, really well. Again, I would suggest that you probably use it after 6 weeks, after the stem cells kind of done this thing. And again, you're going to have about 65 generations, 65 days where the stem cells are dividing. So we don't want to use it too early on, but what I found, 6-8 weeks after the stem cell injection, it works beautifully. Okay, so let's talk about the time frame of how many patches you're going to need. So with all the research our doctors have done, they have found that, and we've been working with this for 16 years, basically to figure out the best application and what works for the best results. And as far as the patches goes, these patches, basically what you want to do is you want to use one patch and leave it on for 2 days, so 48 hours, and then take it off, and then then don't put the patch in for a day, and then do it again for 2 days. So you want to use, you're going to go through about 6 of these in a month. So you want to do, for the first 2 weeks, you're basically using 3 patches, and then the last 2 weeks of the month, you're not using the patches. As far as the LC balancer, you're going to want to go through 1 bottle a week, okay? So you're going to go through about 4 bottles for the month. So the recommended applications for this, you want to take 3 capsules 3 times a day. So again, this will last you a week, and you're going to need about 4 of these for a month. Typical 1-month protocol for this, you're going to need 6 of this, 4 of this. And that seems to work really well. And the way you do this is you open this up, take the patch off, and if it's like, let's say your shoulder, you put it right where the pain is. If it's your disc, you put it right where the vertebra is, right? And leave it there. And 48 hours later, you take it off. Now, if you have hair and stuff like that, you may want to shave because it's pretty sticky. It's waterproof too, so you don't have to worry about getting it wet and things like that. You take it off, and you're going to see like some residue on your skin. The best way to take it off is get that residue off. You can use coconut oil, olive oil, use a rag, and just kind of get it off of there like that and just shower. Put this on wherever the site is that you want to use. Let's say if it's your knee, your shoulder, your hip. Leave it on for 48 hours, then take it off and leave it off for a day, then use another patch. And at the same time, you are going to take 3 capsules 3 times a day, every single week. So you're going to go through 1 bottle each. So you're going to need 4 bottles. Okay, so how many months do you need to do this for? Well, you've gotten stem cells in your body, so you're not going to have to do this many, many months, even if you have stenosis and really bad osteoarthritis, because the stem cells are going to do 90% of the work. The thing is that if even after 12 weeks or even 3-4 months, you're still having pain or the pain level hasn't gone down, this is where it fits in beautifully. So the severe the case is on you, the more months you have to do this. So with osteoarthritis, we've seen results in 1 month to 3 months. With stenosis, it takes a bit longer, And so we're typically seeing you're going to need probably 2-3 months to 6 months if it's really severe. With bone spurs, because of the severity of the calcification, how large the bone spurs are, it could take 3 to 6 months, okay? So when you go to that website, you can see you can purchase them by month. With bone-on-bone knees, it can take up to 3 months, 6 months again if it's very severe. Now, again, most people, within about 12 weeks after the stem cells, their knees are way better, so you might just need it for a month. So as far as this disc degeneration goes, herniated disc, spine pain, what you would do is you put it right where the disc is affected, and you could just put it right in the middle of your spine. With bulging herniated disc, there's an imbalance in the nutritional supply and demand, and that's what really weakens the disc because you're not getting enough nutrients in there. And then you can have calcification of the cartilage end plates that delivers the nutrients. So as people get older, these, especially with pro-inflammatory lifestyle and things like that, you see these calcifications throughout people's bodies. Again, the patch will help with getting the nutrients back in and increasing the lymphatic flow, so it's going to get the waste products out. And it's going to help with bulging or herniated disc. It could help with even if the disc has ruptured. So again, you would put the patch right on where that vertebra is. The LC balancer again helps restore the delivery of the nutrients through the cartilaginous end plates. There's another formula that you need to know, which is the Brown formula, which is implemented with stenosis, especially if there's calcifications widespread throughout your body. So what our research has shown is that there's a protein called the matrix GLA protein, and what that basically does, it regulates the cell growth and prevents cell growth beyond optimal. So what happens, the cell is getting nutrients, it's growing, and then it gets carboxylated, and when it does, it gets to the optimum size. And what this does, it helps with that. And so this Brown formula actually supports your liver, supports your bile formation in your liver, and it helps with the calcification around your body. So again, if you have severe stenosis, if you have bone spurs throughout your body, throughout your spine, you're going to want to get the Brown formula as well. So go to that website that I mentioned, regenerbs.com, and you'll see more information on it. You can purchase these formulas and the patches there. There's a phone number you can call, and there'll be someone that could help you through this whole thing too. So again, this is a secret that I use to help my patients get to the results that they're getting. And again, that's why I want to share this with you in this enhancement program, because I know it's going to help you. So I'll see you in the next video.